Thank you, Arvind. Now we go into next talk. We have Dr. BNR Subudhi, all the way from Odisha. I think one corner to other corner of the country, and we know that he is one of the most available person in this society work as well as academic, and more often he is involved in a large number of community works, especially a screening of a patient in a community. I know that he has very strong way to go for a diabetic patients, and he's going to highlight the screening part. Dr. Subudhi, please.
Thank you, sir, for giving the good introduction. So first of all, I thank Drishti 2022 and my friend Dr. Srini, Dr. Gopal, and all giving the opportunity to speak in front of you on the occasion of Kerala Society Conference. So as everybody knows, that the diabetic retinopathy is increasing. This month we are celebrating or organizing the Diabetic Retinopathy Screening Month. It's not World Diabetic Day, it's World Diabetic Month. So as the prevalence, everybody knows the prevalence of diabetes is increasing, and so also in the post-COVID era, because of rampant use of steroids, the diabetic retinopathy is increased. So it is emerged as one of the most important ocular morbidity in India, and it is increased to such a magnitude that it poses a lot of problems, a lot of challenges for everybody. And already I told COVID-19 has further increased the problem, and hence screening and management DR has posed significant challenges in the post-COVID era. So if you see this newspaper cutting, if you know that the number of diabetics among poor is rising and most of the rural areas. So in a survey, it has been seen that all the cities in the country, capital cities of the country, the HbA1c is taken, it is more than 8%. That means it's a poor control of diabetes. So this leads to a lot of eye complications. If we can reduce 1% or 1 gram of this HbA1c, probably can reduce complications by 50%. So diabetic retinopathy issues in India, the more rural population, illiteracy, low awareness, low economy, and expensive treatment. Whatever you give, that's really very expensive treatment. So in doctors' issues, knowledge about diabetic retinopathy, mostly by the physicians, mostly by the general practitioners who do diabetic practice is very, very meager, because we teach them the diabetes retinopathy in 3rd year. And there hardly there is a referral from the people, the diabetologist to the ophthalmologist, fear of losing the patient, and because they do not know, so they do not refer. The patient's issues are related to uncontrolled diabetes, lack of education, unaware of the diabetic complications. Everybody doesn't know, people do not know that they will land in complications after 5 to 10 years of diabetes in their body. The poor infrastructure in the rural community where the screening was not at all possible, people do not visit the hospitals. So leave aside the eye and leave aside the diabetic patients. So poor counseling by the health workers also. Infrastructure issues, as I told, the rural areas are deprived of the modern equipments, and the tertiary hospitals are very, very few in our country, and the financial constraints are low for the low socioeconomic group of people who reside in the rural areas. 80% of people live in the rural areas compared to 20% people live in the urban areas. So another important factor is the diabetic retinopathy care is in India, the distance followed by the travel. So most of the times the people have to travel long distance to get their eyes checked, not only once, frequently. And if they got the advanced diabetic retinopathy, they have to go at least once in 2 months or 3 months. It's very expensive for them. And elderly people always need the youngest to take them, and younger people have no time to care for their elders. So challenges for DR management is always there. So inadequate facilities, as I told you, for diagnosis, investigation, treatment, particularly in the rural areas. And asymptomatic, as you know, already diabetic retinopathy is asymptomatic till the late stage. When the patient comes to us, it's almost in the middle stage of late stage of NPDR. And late presentation to the ophthalmologist, available retina and eye specialists are very few. Some of the ophthalmologists are still not trained how to inject intravitreal this ranibizumab. So lack of good referral system is also existing in the rural areas. So what measures to be taken? So massive awareness is most important in the rural areas particularly. We are all concerned the cities. So display of banners, public meetings, distribution leaflets, media, and television, they play a major role distributing, educating the people. This year's diabetes, educate your people about the diabetes. This year's the slogan for the Diabetic Day, World Diabetic Day or World Diabetic Month. Educate. Screening by non-meditative fundus cameras and smartphone fundus is very essential nowadays to screen the diabetic. And teleophthalmology plays a major role because teleophthalmology only amenity which can reach the rural areas so to screen the people. And aggressive referral system is the need of the hour. Screening. So who should screen? Anybody, ophthalmologist, optometrist, ophthalmic assistants, anybody can do the screening. Or you can train a field level worker who are in the work in the rural areas to how to take the photographs. Then how to screen. Any non-mediatic cameras attached to the smart camera, smartphones. Smartphone is available everywhere. So if you can give an attachment, we can screen all diabetic retinopathy patients. And of course, whom to screen? Anyone having diabetes is to be screened. Even normal population after the age of 40 years, they should screen for diabetes. And if they develop, they seen diabetic, they should check for the diabetic retinopathy also. So these are the various screening devices available in the market. I don't have any financial interest in any of the machines, but they are economic, they are useful, they are portable, they can be carried, even simple cycle, tricycle, cycle, bike also to the rural areas for the screening purpose. These are the awareness banners we have prepared long time back about the banners by IMA PDB program. This should be displayed in almost all the clinics, labs, pathology clinics, physicians clinics, quacks also even, because many times quacks treat the diabetic patients. So awareness is the most important. Awareness by the media. The people accept very well. If a media person, if Amitabh Bachchan speaks, the people listen to very well. They can understand the thing. So let us utilize these Bollywood stars to utilize for this awareness program. Role of teleophthalmology, yes, very important. Teleophthalmology is an effective model for the improving eye care facilities in the rural areas and unserved areas of the India. It allowed clinicians to take the clinic to a rural area. Whole setup can be taken. There are all portable machines are available. This can be taken to rural areas. And it provide high quality, cost-effective community eye care at the doorstep of the patients. That's very important. So we have got a 3-tier measurement. First tier, the primary health center, they should screen the people. If they can manage, they can counsel very well. Then secondary health centers where they can give little bit intravitreal injections. They can do the lasers also. If it is required for the management of intraocular retinal surgery, they should go refer to the tertiary care centers. So all these things can be linked with the teleophthalmology. So awareness and screening are the very key words for the creation of a diabetic retinopathy screening. So these are the different committees has been established. DR Task Force Committee, a DR Committee, IMA PDB Standing Committee. Teleophthalmology Society of India has taken the upper hand to do this creating the awareness in society. So this is the Teleophthalmology Society of India, now recently established. I want everybody to be a member of the society and we can work together. Be a member of TOSI, that's the Teleophthalmology Society of India. Website is given, tosi.org.in. Be a member and enrich our hands to work for the rural community. So let us join together, lend our hands. So all these things everybody is doing, but randomly they are doing. So why not join together and do a proper screening of the people? So 3 S's. We need to make diabetes care available, accessible, and affordable to each and every one of our country. So take a message, future status by DR screening can be awareness through all means, including social media. Aggressive screening is very important. Then smartphone with AI-based imaging, teleophthalmic services with remote retinal screening, and door-to-door visit is also very essential by paramedics. Optimize the diabetic care, check the blood sugar, control the blood sugar, they are very important. National diabetes registry should be maintained, it should be created, so that all diabetes in our country can be registered, and also it will show that whether they have been, anytime they have been screened for diabetic retinopathy. So our national slogan should be, beat diabetic blindness by screening all diabetics. Everybody should follow this, so that at least we can reduce the diabetic in our country and diabetic blindness in our country. Let us make India diabetic free, diabetic blindness free. So thank you very much for joining with me in this month of diabetic month, that is 14th November to 14th December. We are organizing various programs in rural areas, rural camps. Please do that, at least to help the India and make the India diabetic free population. Thank you very much for giving the opportunity to stand before you. Thank you.
Thank you, Dr. Subudhi. It was a wonderful talk. We can understand you are one of the torch bearer in the country for working against the diabetic blindness. We appreciate that. And from my side, I'd like to really congratulate you for initiating so many things against the blindness and including diabetes also, and getting into so many task forces.
I need your blessing for the National Diabetic Registry. You can initiate.
That we can work on, and I think TOSI is, is, I think, way forward for all of us.
Thank
I
you,
hope
sir.
that people get motivated and join you for all these things.
Thank you, sir, for your motivation.